I couldn't read, couldn't talk to people. I was afraid of going out. So after one treatment of acupuncture, the terrible pain in the top of my head went completely. I've never had it since.
Although at present anyone can set up and practice acupuncture in this country, there are some qualified doctors who use it alongside ordinary medicine. I spoke to one of them about how acupuncture works.
Well, there are two theories. There's a traditional theory, which is shown on this diagram, and there's a modern Western scientific theory. In the traditional Chinese theory, one has these lines drawn as on this figure. And these lines connect the various points marked here called acupuncture points, the line being called a meridian, with the internal organ which affects them. For example, the liver meridian runs from here, the inside of the foot, up the inside of the leg to the region of the liver. And hence, if one wants to affect the liver, one puts a needle in one of these liver points. From the point of view of Western medicine, one speaks of nerves, which are physical structures which one can see with the eye and under the microscope. And from that point of view, one stimulates one of the minor branches of a nerve, which then goes to the spinal cord, possibly to the lower centers of the brain, and then it sends an impulse back along a different nerve back to the diseased organ, such as the liver.
Would you say then that acupuncture was a cure for just about everything?
Oh no, basically for only illnesses where there is enough regenerative power in the body. One cannot, for example, cure a kidney stone or a gallstone that is already there. But something where the functioning of the body is disturbed, as for example in angina pectoris, migraine, headaches, duodenal ulcers, lumbago, sciatica, some skin diseases, some women's diseases, and a host of others, their acupuncture will work. But the proportion varies. Some of the easier things, like headache or migraine, it'll help or cure about 75% of patients of, I should say, of uncomplicated type of cases.
This woman suffered from diseased fallopian tubes. She attends an acupuncture clinic.
I was hospitalized. Doctors insisted that I sign and have it removed. And I insisted that I don't want to have it removed. And what's life like now? Well, it's normal. I'm very grateful to acupuncture. And I think that anybody, before they have anything drastic done to themselves, which they cannot repair, like cutting out a part, or giving up hope, or becoming nervous beyond coming back, they should try acupuncture.
How does one have to be qualified to set up as an acupuncturist in this country?
Well, I think the best type of qualification is if one's already a doctor, knows ordinary medicine already, and then studies acupuncture on top of it. And if one wants to be still better, it is an advantage to learn Chinese, so one can read the original Chinese books.
Paul was a migraine sufferer for over 16 years. Then he tried acupuncture. It worked for him, and now he's a patient only for preventative reasons.
I think the last two treatments were something like several months between them. And now it's left that if I get a headache or 6 months comes up, whichever comes first, come back and see him. And now I've been cured now for 2 years. I can have wine with my meal, I can enjoy myself, I can relax, I can get excited if I want to, without the fear of a headache coming on.
Recently, the doctor we talked to has experimented with acupuncture as an anesthetic. He anesthetized this patient's throat as if for a tonsillectomy.
Well, some needles were put in my hand, and then I was waiting to feel something, but I didn't feel anything at all. I didn't even feel when the doctor put some needles into my throat and pricked me.
Have you ever been under anesthetic?
Oh, yes.
What is the difference of the feeling between that and acupuncture?
I did not feel any numbness, and I kept on waiting for the numbness, so I didn't believe that it actually was good. But it is.
I think it would help certain patients who have bad hearts to withstand surgery if they have acupuncture by anesthesia by acupuncture, and partly there are many people who think that acupuncture is hypnosis or something of the sort, but I don't think one can disbelieve it if people can be anaesthetized.
What about the idea that people put forward that any effect that you have, it's a bit like having pink sugar pills or a dummy injection, that it's only psychological?
Well, I wish it was. One's tried all the drugs, one's tried everything that the pharmacists can come up with, and they haven't worked.